Noswaith dda, good evening. Wales has recorded the highest number of deaths from drug misuse since records began. The Office for National Statistics found while there were 149 deaths recorded in 2020, it went up to 210 last year. That's the equivalent rate of just over 72 deaths per million people in Wales in 2021, which is above the overall drug death rate in England. Sharon Preet-Kara has been talking to one charity in Wales which says we need to radically rethink our drugs policy.
With the lines in, that's where I used heroin for the first time and crack.
Cullen Mace is taking me on a trip down memory lane. But these aren't happy memories.
Mike, who was passed away in here, who was an alcoholic, Lego in the middle floor, and Lenny as well. That's just 3 in this block, you know. I started smoking cannabis really heavy at the age of 15, 16. By 18, I am addicted to heroin, or using heroin, just, you know, every other week. By the time I'm 19, I'm fully addicted to heroin and using crack cocaine. I'm scrounging every day to make money, stealing off my family, stealing off friends, swindling people. I started becoming a shoplifter, and this is where prison came in.
This was Cullen then, one of many such mugshots from 11 stints in prison. His addiction felt impossible to overcome until he tried a new treatment called Buvidal. Buvidal stops you from feeling the intense symptoms of heroin withdrawal, allowing Cullen to stop craving the drug and change his life for good.
Your confidence comes back, you know, that ambition comes back. You know, the young boy I once was has come back.
The Welsh Government first approved Buvidal in 2019 and its rollout was ramped up in the pandemic. With Wales's drugs deaths at an all-time high, charities say new approaches like this could save lives.
The war on drugs is not an effective way of dealing with these problems. I think what is refreshing from the Welsh Government is we are seeing new ways of working, which I think will start bearing fruit in terms of keeping people alive.
This is naloxone, another of those new ways of working. It's a different injection used to treat overdoses to opiates like heroin. The drug itself is nothing new, but in Wales, it's being delivered by people with real experience of drugs.
I was like stuck in active addiction, so I was going round in circles constantly, getting clean, relapsing, getting clean, relapsing.
Now Leighton's beat that cycle by saving the lives of other heroin users with naloxone.
Puts a smile on your face when you do see the people you've saved, yeah. Someone's son, someone's daughter, someone's father, potentially.
Wales is the first nation in the UK to implement this national peer-to-peer approach.
Typically, we don't see the good in people who use drugs. This project reframes all of that, and what we tell people is that their lived experience absolutely matters, that they've got like a qualification that nobody wants. They've got a street degree, right, and their street degree is involved in pain and trauma.
By September, the project will be rolled out across the whole of Wales, a radical rethink to how we treat addiction that's been backed by the First Minister.
It is about just recognising the reality that there are people whose lives have been, taken over in that way.
He spoke to Cullen on his podcast, a reflection of how far his life has come.
I used to live in here when I was on the run. Every time I used to go on the run from the police and I couldn't go to my parents and my friends, I used to live in this room. I used to stay in this room with a blanket on my own. So to actually manifest this place into something where we've had some great people, some inspiring people, and had some great conversations, it's just extraordinary.
Now Cullen has a girlfriend, a family, a home. All things he traces back to that injection of Buvidal.
Well, an extraordinary story from Cullen, Sharon Preet. But if these new treatments are being rolled out in Wales, why are the drug deaths so high?
Well, Rebecca, the simple answer is time. These initiatives are all quite new and it'll take a bit of time before we can see what effect they'll have. I mean, Buvidal just started to be rolled out during the pandemic, although the early signs are that it's having a really good effect. And when it comes to that peer-to-peer naloxone programme, we'll have to wait until September until it's been spread throughout the whole of Wales. So those success stories that charities are seeing, it might take some time before those filter through to the statistics.
Yeah, so the charities are hearing positive feedback, but how do we know this approach will work?
Well, we can look at two cities, Swansea and Newport, traditionally two Welsh hotspots when it does come to drugs. Now, last year, Swansea recorded over 11 drug deaths per 100,000 in the population. Compare that to Newport, 5 per 100,000. That is a huge postcode lottery. We're talking about double the deaths in Swansea than Newport. Now, I asked the drugs charity Kaleidoscope about that. They pointed out that that peer-to-peer naloxone programme started off in Newport. It's been going for 2 years and saving lives. They also say the approach they're taking in Newport has been a bit different. Rather than criminalising drugs, treating it as a public health issue. Now, they argue that should go even further and that we should be looking at things like heroin prescribing, giving the drug in a safe way to users to prevent them buying it on the street.
And could those ideas happen in Wales?
Well, Rebecca, the issue there is politics. Now, a lot of these powers rest with the UK government. They say that this landmark drug strategy will prevent nearly 1,000 deaths by rebuilding drug treatment services. But many people like Cullen want Wales to stand up and have its own drugs policy. Welsh Government has been spending 63 million a year on projects like Buvidal, but whether it will try and set up its own policy distinct to across the border remains to be seen.
Sharon Preet, thank you. And if you've been affected by the issues raised in this story, information and support is available on the BBC Action Line website.